Have you ever felt lightheaded when you stood up too fast? Or like the room was spinning around you, even though you weren't moving? That uneasy feeling could be dizziness or vertigo, and trust me, you're not the only one who's experienced it. In today's video, we'll explain what dizziness and vertigo really are, what causes them, and most importantly, how to manage or treat them. Whether it's something simple or a sign of something more serious, it's good to know the facts. Let's get started. First things first, what's the difference between dizziness and vertigo? Dizziness is a broad term. It can mean feeling lightheaded, unsteady, or like you're going to faint. Vertigo, on the other hand, is a specific type of dizziness where you feel like you or your surroundings are spinning, even when you're standing still. Think of it like this. All vertigo is dizziness, but not all dizziness is vertigo. Now, let's look at what causes dizziness and vertigo. Did you know the inner ear, which controls balance, is no bigger than a pencil eraser? Yet it plays a huge role in making sure stay upright. That's why it is important to know its causes. There are quite a few reasons why you are feeling dizzy, and they're generally classified into two groups: peripheral causes and central causes. Peripheral causes related to the inner ear, benign paroxysmal positional vertigo, BPPV. This is the most common cause. It happens when tiny calcium crystals in your inner ear shift out of place. You might notice symptoms when you turn your head or get out of bed. Vestibular neuritis or labyrinthitis. This is usually due to a viral infection that inflames the inner ear or the nerves connecting it to the brain. Meniere's disease, a condition where fluid builds up in the inner ear, causing vertigo, hearing loss, and ringing in the ear. Tinnitus. Central causes related to the brain, migraine-associated vertigo. Some people experience dizziness or vertigo with their migraines, even without the headache, stroke, or transient ischemic attack. Dizziness may be a warning sign, especially if it comes on suddenly and is associated with other symptoms like slurred speech or weakness. Brain tumors or multiple sclerosis. Less common, but these can affect the brain's balance centers and cause persistent vertigo. Now here's something many people overlook: dizziness related to heart and blood pressure. Presyncopal dizziness occurs in heart issues, artery blockage, orthostatic hypotension, medication effects, or other causes that leads to brain hypoperfusion. Syncope is a transient, self-limited loss of consciousness due to acute impairment of blood flow to the brain. This syncope may be preceded by dizziness or vertigo, which is worrisome. Other causes of dizziness include gait disorders due to disruption in sensory neuronal pathways, like Parkinsonism. In many instances, during exacerbation of cervical spondylosis, also one may get intermittent vertigo symptoms. Weakness resulting from any anemia, dehydration, deficiencies may also make you feel dizzy. And yes, anxiety can trick your body into feeling dizzy. Anxiety-induced dizziness is sometimes called phantom vertigo. Your brain thinks there's a balance problem even when there isn't. Let's talk about the other associated symptoms. Along with the spinning sensation, people may also experience nausea or vomiting, sweating, unsteadiness or imbalance, difficulty focusing the eyes, hearing changes or ringing in the ears, especially in Meniere's. If your dizziness comes with a sudden severe headache, vision problems, trouble speaking, or weakness, seek medical help immediately. These could be signs of stroke. Pregnant women often feel dizziness because of some physiological changes in the body. Hormonal changes. Increased levels of progesterone relax your blood vessels. This can cause blood pressure to drop, especially when standing up quickly, leading to lightheadedness, changes in blood circulation. Your body produces more blood to support the baby, but the heart takes time to adjust. Blood may not reach the brain fast enough, causing dizziness. Low blood sugar or hypoglycemia. Growing baby uses more energy, and missed meals or long gaps between eating can lower blood sugar, causing weakness and dizziness. Lying on the back, especially later in pregnancy. because the uterus presses on the large vein called inferior vena cava when lying flat. It reduces blood flow back to the heart and brain, called supine hypotensive syndrome, anemia or low hemoglobin, the increased demand for iron to support baby's development. As a result, less oxygen is delivered to the brain, leading to dizziness and fatigue. Dehydration, vomiting from morning sickness, or not drinking enough fluids. Reduced blood volume, leading to dizziness. Please be cautious in delaying to approach your doctor if you're pregnant, as other medical conditions may also be associated. So, how do doctors figure out what's causing your dizziness? First, a detailed history is taken. When it started, what triggers it, and any associated symptoms. Doctor emphasizes on certain questions to know. Is it dangerous? As in heart problems, stroke, etc. Is it vestibular or ear-related? If vestibular, is it central or peripheral? Then comes the physical examination, including balance and eye movement tests. Tests like the Dix-Hallpike maneuver can help diagnose benign paroxysmal positional vertigo or BPPV. Have you ever had a strange episode of dizziness that came and went without any clue why? What did your doctor say? Share your story below. The common causes of brief dizziness, which stays for seconds, include both BPPV and orthostatic hypotension. Both are provoked by changes in head and or body position relative to gravity. When episodes are of intermediate duration that last for minutes, insufficient blood supply to the brain is usually suspected. However, migraine or other causes may also be possible. Attacks of Meniere's disease often last hours. The cause behind persistent vertigo often found to be tumor, multiple sclerosis, or other central causes. Isn't it interesting that doctors suspect your disease and proceed for investigations based on the details and vertigo duration? What we have discussed are not the only reasons of vertigo, but the common ones. Therefore, sometimes imaging like MRI or CT scans are needed, especially if a central cause is suspected. Hearing tests may be done if inner ear problems are suspected. One-sided hearing loss or other recently developing ear pain, pressure in ear, feeling of fullness, ringing in the early typically point towards peripheral causes we have already discussed. Vertigo associated with double vision, numbness limb imbalance suggests a lesion in the parts of the brain called cerebellum and brainstem. Uncontrollable rapid eye movement, what is called as nystagmus, is also found in brain origin vertigo symptoms. Most cases of dizziness and vertigo are treatable. For BPPV, the Epley maneuver or similar head movements can help shift the displaced crystals in the ear back to where they belong. It's often effective within just a few sessions. For vestibular neuritis or labyrinthitis, it may take a few days to recover, but medications like anti-nausea drugs, steroids, or vestibular rehab exercises can help. For Meniere's disease, low-salt diets, diuretics, and medications to reduce vertigo attacks are commonly used. For migraine-related vertigo, lifestyle changes and medications can help reduce vertigo episodes. For more serious causes like high or low blood pressure, stroke, the person needs emergency care and evaluation of the underlying cause. So when should you worry? If your dizziness is sudden and severe, if you have double vision, speech problems, or weakness, if it keeps coming back without a clear reason, or if it's affecting your daily life, don't brush it off, especially if it's new or feels different from past episodes. Here are some simple things that can help to avoid these uncomfortable situations. Stay hydrated. Dehydration is a common cause of lightheadedness. Avoid sudden position changes. Sudden standing up causes blood pressure to drop, what we call orthostatic hypotension. Stand up slowly, especially from a bed or a seated position. Elderly people should be more careful for this, as they are prone to orthostatic hypotension. Sit for a few seconds before standing up, especially from bed. Avoid caffeine, alcohol, and tobacco. They can affect the inner ear. Get enough sleep. Sleep-deprived brains don't balance well. Have balanced diet and regular meals. Females should include enough iron-rich food. If you have frequent episodes, vestibular rehab therapy, VRT, might help improve your balance. And remember, getting enough sleep and managing stress also go a long way. So that's a wrap on dizziness and vertigo. It can be scary, but with the right diagnosis and treatment, most people recover fully. Home remedy you can adopt on SOS basis if unexpected. However, it should not replace diagnosis. Sip on ginger tea 1 to 2 times a day. You can also chew on a small piece of raw ginger or take ginger candy during episodes. Deep breathing helps to calm anxiety and improves oxygen flow to the brain. Inhale slowly for 4 seconds, hold for 4 seconds, exhale for 4 seconds. Repeat 5 to 10 times. Mix 1 tablespoon of lemon juice and 1 tablespoon honey in a glass of warm water and drink it. You can try peppermint or chamomile tea. Learn Airplay maneuver technique from doctor and physiotherapist if you're diagnosed case of BPPV. Have a favorite home remedy or a tip that helped your vertigo? Drop it in the comments. It might help someone else. If you found this video helpful, don't forget to like, share, and subscribe for more health tips and updates. And if you have any questions or want to share your experience, drop a comment below. I'd love to hear from you.